Hello and welcome back. I'm Dr. Ankit Gupta and today's video is on double lid creation or Asian blepharoplasty. It is especially for those from our northeastern friends, those from the Himachal, those females and males who wish to get a double eyelid, those who genetically do not have double eyelids, they have a single lid and they would want to have a double lid or a crease creation. So this is the crease creation surgery, and with this beautiful female, I'll show you the whole surgery. I'll guide you step by step how the whole procedure is done, how much time it takes. Let's have a look. So friends, this pretty lady came to us from Nepal and she wanted to have a double lid creation surgery or the Asian blepharoplasty. And this is how she looked with her eyes closed, her 3/4 view, her side view, other side, the other side view. And what we do, and the most important step of this surgery is the marking. So we need to make sure that we mark the area where we would want a crease. Before we go for the actual surgery, we do a demo sort of a thing in which we paste a strip across your eyelid to see how much height you would like. But the exact point where I would want a lid crease creation is according to your tarsal plate. So you would have played those games in which you evert your eyes and there's a hard portion on your upper lid. So that hard portion is the actual height where one should have their lid crease. So we evert the lid, we measure exactly how much tarsal plate or that hard portion of the upper lid is, and exactly at that portion we keep the lower margin of our incision. So this is here where we have kept the margin at around 6 to 7 millimeters, and about after 2 millimeters we keep the upper margin, and this is the amount of skin that I would want to remove. This is a very small amount of skin that I am removing in her because she is pretty young. If somebody is much older, like in her 45s, 50s, 55s, then I would want to remove a lot more skin in those cases. So as I have already mentioned, marking is the most important thing, and we redo it. We make sure that we have marked equally on both the sides. Once the marking is complete, we then infiltrate that area. So the first step of the surgery is to give local anesthesia. It is given through very fine needles, very fine syringes. We give the anesthesia to the upper lid, and once the anesthesia is given, the whole of the upper lid will become numb and you do not feel any pain after this. This is like 2 to 3 injections that we have to give on each upper lid, and it is not painful. Believe me, it is a very simple injection. If you have taken vaccines, it is that painful, and she is getting these injections as of now, you can see. And this is how we give anesthesia to both the lids simultaneously, and then we wait for about 5 to 10 minutes, and during this period the anesthesia would work and would make that area completely numb. Once the anesthesia is complete, then we give the incision. I prefer to use a radiofrequency cautery. So this is bloodless kind of a surgery in which as we are cutting it, the blood vessels are getting coagulated. So once we have given incision on both the margins of the cut, we then give the uppercut incision. We go deep, and then there is your muscle, the orbicularis muscle. We go deep through the orbicularis muscle. Then we reach a fat that is usually very prominent in those who have a single lid, who don't have a crease. So what happens is all the fat, it drops down. So we have to reposition this fat. This is how we dissect out all the fat. We reposition it back into the upper area. I do not personally remove a lot of fat. I just burn it to make it a bit smaller. Once we have done this, we then reach a muscle which is called the levator muscle, which is the muscle which causes your eyelid to raise up. When you open your eyes or you close your eyes, that is the levator muscle which opens your eyes. So all we need to do is that now we need to take a stitch from the lid crease margin to the levator muscle back to the lid crease margin, and that is the stitch which will make the lid crease. Once we have repositioned all the fat, we would just remove all the extra skin and a little bit of extra muscle, and then finally these are the lid creation stitches that we need to give. Once these are done, all we need to do is close the skin, and that is all. The sutures are there for 7 days. After 7 days, we remove these stitches. Initially, your lid crease would look very high because of all the swelling. It is almost 1.4 times higher than what it should be. It takes almost 3 weeks to 3 months for the lid crease to drop back to the normal height. So we usually wait for at least 8 weeks and then take a call if we need to revise it. But you need not worry. We have taken the measurements initially and it will be perfect, and you need not worry. So this is how you look immediately after the surgery. You will have a crease which is visible immediately, and then we remove the stitches. This is the amount of skin that we have removed. So if anybody wishes to have this Asian eyelid surgery, they can contact us and our patient management team would be happy to help you. If you want to know more, if you have any doubts, feel free to contact us on 9599554211. Thank you and have a nice day.